Thank you for 20 years of Get With The Guidelines. We've got a lot to celebrate, and we're so happy you're here. Here are a few of the things we've accomplished together. Together, we've tracked more than 10 million patients. Data has been used in more than 600 scientific publications. Since 2016 alone, we've given out almost 32,000 awards to participating hospitals. None of this would be possible without you. If you're one of the nearly 2,500 plus hospitals across the United States and Puerto Rico to implement Get With The Guidelines, thank you for your outstanding performance treating patients with heart disease and stroke with the highest quality care. Get With The Guidelines helps healthcare professionals improve patient outcomes by applying the most up-to-date, evidence-based treatment guidelines. Whether those guidelines are for stroke, heart failure, resuscitation, AFib, or coronary artery disease, hospitals that encourage their consistent use help patients do better. That's quality improvement, and it's what we're all about. Thank you, and here's to the next 20 years together.
Hi, everyone, and welcome to the 2021 Get With The Guidelines Quality Achievement Award Recognition event. I'm Rhianne Archangel with American Heart, American Stroke Association Quality Outcome Research and Analytics team. Thank you for taking the time today to join us. We normally, for many of you that have gone and experienced this award, many of you have been in a ballroom eating dinner together with us, but now we may be used to things being a little different. Some of our colleagues were not able to join us today during this call. So we're going to be recording this program, and we'll share the link shortly after following this event. And we'll also send out a few communications in regards to that so that anyone that could not attend could view it later. On behalf of our faculty, volunteers, and staff at the American Heart Association, I want to thank each and every one of you for the work you do. Thank you for your dedication, your passion, your remarkable accomplishments of your team across the Western region. Your relentless commitment to quality care, especially during this extraordinary year of challenges, is appreciated and celebrated. We usually have the opportunity, and I've done this personally, to shake your hand and give you a certificate on stage. But since together we're virtual, this year, we're going to be showing photos of your award-winning hospitals on a split screen on one side, which you'll probably see here right now. And throughout the duration of the event, we'll be showing the hospital names. We encourage you to type in your congratulations and give shout outs in the chat box to celebrate your colleagues. We also welcome the use of social media and to use the hashtag #RelentlessTogether to share your photos, stories, and messages about your relentless execution of quality patient care over this past year. So we're very pleased to be joined today by 3 national esteemed physician leaders in the Western states and globally. Dr. Jeff Saver, Dr. Jenny Majersik, and Dr. Alex Khalessi. Dr. Jenny Majersik is a professor of neurology at the University of Utah School of Medicine. After receiving her degree in physics from Harvey Mudd School, she served as at the Air Force as a scientific analyst at Wright-Patterson Air Force Base, National Air Force, as in their intelligence center. She completed her internship of neurology residency at the U of U and a vascular neurology fellowship at the University of Michigan. While in Michigan, she earned a graduate degree in clinical research design, biostatistician through her School of Public Health. She's been a stroke neurologist at the U of U since 2008. She's a director of the Stroke Center there. She's 6-state telestroke network. She's a clinical practice includes inpatient and outpatient stroke care, including telestroke. Dr. Alex Khalessi is the chair of neurology surgery and professor of surgery, radiology, and neurosciences at the University of California, San Diego. As a board-certified neurosurgeon, he specializes in complex cranial surgery, endovascular surgery, stroke care, and neurological oncology. Dr. Khalessi serves as the executive committee of the Congress of Neurological Surgeons since 2014, including both scientific program and annual meeting chair. Dr. Khalessi is the only neurosurgeon to serve on the Interventional Advisory Panel for StrokeNet Steering Committee at the NIH and serves as the Board of Governors for the American College of Surgeons. He also serves as the vice chair for the University of California Stroke and Cerebral Vascular Disease Consortium. Dr. Khalessi has published over 150 peer-reviewed papers and monograms with over 200 abstracts and presentations. He also serves as principal and co-investigator for more than 25 clinical trial grants. The intersection between psychology, engineering, and neurosurgical techniques animates his research interest. Dr. Jeff Saver is an SA Vice Chair and Professor of Neurology for the University of California, Los Angeles, and the Director of UCLA Comprehensive Stroke and Vascular Neurology Program. He's an author of over 670 research articles, 3 books, 40 book chapters. Dr. Saver's research interests are acute stroke treatment, stroke prevention, neuroimaging, clinical trial design, and neurocognitive consequences of stroke. He served as PI of the NIH NINS FAST-MAG trial, global co-PI for the SWIFT PRIME trial, and the chair of the American Heart Association Stroke Council. He is currently associate editor for JAMA, an editorial board member for the Journal of Circulation, and is a recipient of the Feinberg Award and Distinguished Scientist Award from the American Heart, American Stroke Association. It is my pleasure to welcome Dr. Jeff Saver.
Thank you so much, Rhiannon. And it is my great pleasure to celebrate all of the hospitals participating in Get With The Guidelines stroke program today. I've put on, this is how we celebrate awards here in Los Angeles and in Hollywood. And the Academy, as well as the American Heart and Stroke Association, have authorized me to shout out to the wonderful work that you all have been doing. I'll be speaking for the next several minutes, giving some information about the particular advances that the Western region has contributed to the Get With The Guidelines stroke program. But while I'm speaking, please note the key information is going up here on the screen beside me, celebrating each of the hospitals that are receiving awards. It is your work on behalf of stroke patients, your incredible work day in, day out, week in, week out, that makes a difference for people across the West that we are celebrating today. So a little bit of Western States history. The very first hospital to join Get With The Guidelines was in 2004 in the Western States. And now in 2021, we have a total of 420 Get With The Guidelines hospitals in Western States, many that you'll be seeing on the screen. The very first hospitals to receive a Target Stroke Honor Roll designation in 2010 in the West. It was a tie between Huntington Hospital and Harborview Medical Center. And as of this month, there are now 245 total Target Stroke Honor Roll hospitals here in the West. Truly an amazing achievement that all of you have been doing. The first TJC AHA Comprehensive Stroke Center certification in the West went to Stanford, and that was in 2012. And we now have a total of 38 Joint Commission certified comprehensive stroke centers in the Western region. And the newest kid on the block, acute stroke ready hospitals, the very first in the West was Hazel Hawkins Memorial, and the currently we now have 7 certified acute stroke ready hospitals in the Western U.S. I'll note that here in the West, we have some distinctive aspects that we have to figure out quality improvement and challenges that we then can spread to the rest of the country. We have an extremely diverse race ethnic population, including more of an Asian population than anywhere else in the country. We have an extensive rural footprint with the need for telemedicine and helicopter transport. Just in the past couple of years, we have helped initiate the arrival of mobile stroke units of care that are likely going to become a bigger part of our system and quality improvement in the future. And we also, this past year, coped with distinctive challenges with COVID, with the particular surges in Washington State, in California, and elsewhere, that all of you so wonderfully responded to and made sure that stroke patients who 2% to 3% of all COVID patients hospitalized will develop a stroke, and they could know that they were going to get great care when they arrived at the hospitals being shown on the screen today. So it has been a great pleasure to be able to introduce this first segment of the celebration today. And it's my pleasure now to share a special message from the American Heart Association CEO, Nancy Brown.
Hi, I'm Nancy Brown, CEO of the American Heart Association. Thank you so much for joining us today and for powering our mission to be a relentless force for a world of longer, healthier lives. Science and research are the bedrock of the American Heart Association, and a key pillar of our work in bringing science to life is our Get With the Guidelines Quality Improvement Program. We launched the program in the year 2000 to assure that patients with coronary artery disease received high-quality, evidence-based care during their hospital stay. Over the past 2 decades, Get With the Guidelines has expanded to include heart failure, stroke, atrial fibrillation, and most recently, the COVID-19 cardiovascular disease registry. Stroke is the largest of our Get With the Guidelines programs, with more than 80% of every stroke that happens in this country captured in our registry. In just over 2 decades, you, our valued partners in hospitals across the country, have collected data from more than 10 million patients, profoundly deepening scientific understanding of cardiovascular disease. This work is more important than ever as the world confronts COVID-19 because severe outcomes are most common in people with a history of risk factors for heart disease or stroke. Hardest hit are Black, Hispanic, and Indigenous individuals living in under-resourced communities. As a champion of health equity, the American Heart Association is leveraging its voice, our platform, and our resources to identify and remove barriers to healthy living. Our Don't Die of Doubt campaign informs the public that hospitals are still the safest place to be in a medical emergency, as we urge people to call 911 at the first sign of a stroke or a heart attack. As a founding supporter of the Ad Council campaign to encourage COVID-19 vaccination, we are boosting public confidence and helping to keep people safe. We are also encouraging everyone to get their flu vaccination and schedule routine and preventative care. In 12 months since launching a 3-year hemorrhagic stroke initiative with Alexion, we have identified best practices and additional insights that we look forward to sharing across the country. None of this would be possible without your heroic efforts on the front line of stroke care. During an extraordinarily challenging year, you have displayed uncommon courage, collaboration, and clinical excellence. On behalf of all of us at the American Heart Association, thank you for your dedication to ensuring all people have the opportunity to live a longer, healthier life.
Hello, Western State Stroke Champions. As you heard earlier, my name is Jenny Majersik, and I'm at the University of Utah, where yesterday I think it was 70 degrees for the Easter weekend, and now it's snowing, just showing the capriciousness of the weather we have here. I am so happy to be a part of this celebration with all of the hospitals that I know and even the ones I don't know, because I am just really excited for the Western states and how well we're doing. One of the things that I love about working here in the Western states is that we understand that stroke care requires collaboration, not only across the urban landscapes, such as Dr. Saber works in, but also across really vast and very rural distances, often with treacherous roads and weather like we have here today. I don't know how many of you saw at the International Stroke Conference, one of our Australian colleagues was speaking about the incredibly long transport times for thrombectomy in Australia. And I thought that could be any one of our states who's on the screen today. And because we understand what it means to provide care across big differences, across big spaces. And you'd think that that'd be daunting, providing stroke care to sparse populations that don't have a thrombectomy center in every town. But I get to share with you today that you are all rocking it. So I pulled a little bit of data with the help of Rianne, who's our hostess today, and found that in the Western region, we are the fastest at revascularization in the whole country. So I'm going to give you a couple facts. Almost 90% of our patients receive thrombolytics in under 60 minutes, and that's compared to 85% nationally. And almost 70% of our patients receive it in under 45 minutes, compared to only 62% in the rest of the United States. And not only that, but for thrombectomy, 38% of our patients have fast door-to-device start time, compared to just 37% nationally. And you'd think that this wouldn't be that easy for us because of our adverse, if beautiful, geography. And I was wondering why. Why are we so good? And this data from the Get With The Guidelines doesn't tell us, but I can speculate a little bit based on working with so many hospitals across the Intermountain West. What I see every day are passionate and smart nurses, data coordinators, EMS providers, ER doctors, neurologists, telestrokeologists. I see professionals willing to help each other out by providing best practices to their counterparts in other hospitals. They provide feedback to care, and ultimately all of this effort improves the care across our region. And also a shout out to the AHA, who's helping us today to celebrate all of the hard work we've done, because I see their representatives traveling the distances to make sure that every hospital has the stroke education and data collection tools that they need. They help advise us on policy development that will ensure our patients get the best care as fast as possible. And I really do see them bringing us all together. So I'm in red today to celebrate awesome stroke care in the Western regions and each and every one of you. And now it's my pleasure to extend that celebration to introduce the Executive Vice President for the Western States region of the American Heart Association. And please welcome Kathy Rogers.
Well, hello, everyone, and thank you, Dr. Sorry, Jennifer, I'm not even going to say your name right. Thank you so much for introducing me, and I'm just so happy to be here today in the celebration of all of you, and I love seeing the great photos of all of the hospitals, and I hope you are cheering as you are watching today's broadcast for the great work that all of you have done. You know, I was thinking about last year's International Stroke Conference and the Festive Awards. As Rianne said, we always get to be together to see each other. And I was thinking about it because it was held right here in LA where I am. And I think next time, Dr. Saber, I'm going to need to get a similar hat as you to make sure that we are representing the Hollywood style for this awards, and hopefully we'll be in person. But I also reflect on what we've all gone through over the past year. And I know each of you and your hospitals have really walked through different tragic and difficult paths over the past year with the pandemic. And I know our losses have been many, but what I'm most humbled by is by your strength and your unwavering commitment to the patients that you serve, and especially those patients who have experienced a stroke. The dedication to ensuring that care is provided to patients that is aligned with the latest, research and the research-based guidelines is reflected in the awards that you are all receiving today. You've made a world of difference for the patients, for their families, and your unwavering commitment to ensuring they get the best of care for all of our families across the 10 states of the Western region. And for that, I want to thank you from the bottom of my heart, because truly, this is about you and the great work that all of you have done. Since the beginning, as you heard, with the American Heart Association, American Stroke Association's game-changing quality program, we've had such outstanding leadership in our volunteers. And I want to say a special thank you to Dr. Khalessi, Dr. Majersik, and Dr. Saver for all that they've done. They've been the champions, as well as all of you, behind us making sure that we are delivering that quality care to our patients. I also want to acknowledge that we have had outstanding participation. You heard us say that as well. We've had more than 300 hospitals being recognized today, which is really the highest number that we've had ever in the region for stroke and Get With the Guidelines. So thank you. And I know we've talked about the patients and the survivors, and really I know that's why we all do the work that we do, so we can save lives, improve lives. And it's my privilege now to introduce you to Myra. And Myra is, like all of you, a healthcare professional, and her story truly embodies what we're talking about today and today's theme of being relentless and tenacious. And before you get to see Myra, let's watch a short news clip. Thank you.
Welcome back to the show. When you hear the word stroke, a lot of people automatically assume you must be talking about somebody elderly. But as Jim shows us tonight, a stroke has no age limit.
As a nursing student, Myra Wilson's dream was to one day help patients get well. But she never imagined how suddenly she would be the one who needed help.
When the nurse said, "You're having a stroke and I'm going to call a code," I was thinking, I'm not having a stroke.
Myra was lucky. Her stroke occurred at a hospital where the staff saw the warning signs and were able to get help immediately.
They went through the femoral artery, up through the body, into the brain, and pulled the clot out of the brain.
At just 41, Myra thought she was too young to have a stroke. But the fact is, stroke can happen to anyone at any time.
You look for signs, symptoms. You know, that's what you do. Don't worry about the person's age. If they're showing signs of stroke, you just get help fast.
Hi, I'm Myra Wilson, stroke survivor. First of all, thank you, Kathy, for your wonderful introduction. I do appreciate you so much. Congratulations to everyone out there. We certainly do rely on the work that you do. You have made me a stroke survivor. Thank you so much, and congratulations. I was certainly working at the hospital, and I did suffer a stroke around other medical professionals. I had blurred vision, headache, weakness on my left side, which is my dominant side. And I was taken to the emergency room at that time. I had undergone a CT scan that determined I had an ischemic stroke, and I was therefore given TPA. I was transferred to a different hospital and underwent a thrombectomy. I woke up in the ICU, remembering the last thing that the other doctor had said to my classmate, which was, "Is this smile normal for her?" And I realized there was something that the classmate had said that was abnormal. She said, "No, that's not normal." So when I took a picture of my face, I realized, yeah, this was not normal. So I had the facial paralysis. I was in the hospital for 3 weeks for stroke recovery. This kind of curtailed my plans of becoming an OR nurse. And so I had to figure out something else during that time. But I went through my stroke recovery, physical therapy, occupational therapy, et cetera. And I was able to go home where I recovered some more. After about a year, I was able to go back to work, where I am still in the medical field, and I'm happy to be there. I just do something that's quite a bit different than what my original plan was. I am happy to be a stroke survivor, and I appreciate everyone involved that has reached out to stroke survivors, all the science that's out there, all the education that's out there. I definitely appreciate everyone involved for providing that to our community. And I personally will be continuing to volunteer in the community to bring awareness about stroke and also share my story. I'm happy to be in the medical field, and thank you so much for you being you. We rely on all the work that all of you do. I really do appreciate you. Thank you so much.
Thank you so much, Myra. Thank you for sharing your powerful story. We're glad that you're here with us today to celebrate in person. And I just want to say you inspire us to remain relentless together. And, now it's my pleasure to bring you a special message from our AHA chair of the Stroke System of Care Advisory Group, from Dr. Lee Schwamm, and the incoming chair, Dr. Stephen Massey.
Hello, and welcome to the Get With the Guidelines Stroke Virtual Quality Achievement Awards. I'm Dr. Schwamm, and I'm here tonight with my colleague and friend, Dr. Stephen Massey. Hi, Steve.
Lee, it's virtually good to see you, as always.
Yes, and Steve, it's great to be passing the torch, or the crown, shall we say, as chair of the Stroke Systems Advisory Committee. Congratulations, and really looking forward to working with you in this new role.
Well, thank you, Lee. And I do want to say that, you really were instrumental in building Get With the Guidelines to the important, role that it plays today. And so thank you for everything you've done. And, you will always remain the emeritus king and ex officio forevermore.
Excellent. Relentless together. I would say that's you and I will be relentless together in this task, but tell us what that means to the Heart Association.
Well, so relentless has always been, an important theme for the American Heart Association. And this year in particular, obviously, we had to pull together with all the challenges that we faced. And there's no question that we did that. And this is thanks to all of you and the hard work that you do. But it's clearly being relentless together was the key to getting through this.
Yes, and nobody demonstrated that more, I think, than our frontline staff and nurses in particular. And just want to take this moment to really thank all of you out there who work in the nursing profession, all of you who work to take care of stroke patients, but especially take this opportunity to recognize this as the Year of the Nurse, and we're all extraordinarily grateful to you for that. We've had some amazing accomplishments this year. The public reporting of Get With the Guidelines data is the next evolution in our goal to really becoming the source of truth when it comes to quality stroke care. Have 152 hospitals are now participating. This data gets used by U.S. News in its hospital ranking system, and for some hospitals with health plans. So spring enrollment coming up beginning in May. If you're not in already, sign up. We're in. Steve, are you guys in?
I think we are definitely in. Yeah, it's very useful. So that's going to continue to grow. And speaking of growth here, of course, we're seeing continued enrollment in patients being logged into the database. So now over 7 million this year is where the threshold we passed. And by 2024, we're going to get to 10 million, which is absolutely incredible.
That could be more number of cases than I have unread emails in my inbox, Steve. Speaking of unbelievable growth, here's the just distribution of publications from this program, over 150 searchable database if you want to look and see on a particular topic or a particular module. But it's been a remarkable journey, and we've made such an impact on the care of stroke in the United States, and had quite a showing at this year's International Stroke Conference.
For sure. And some of those have already been published. They were done in time with the stroke conference and are very relevant to all the things we've been dealing with this year.
Yes, and Dr. Srivastava with Dr. Fonero published this very important analysis in Get With the Guidelines using the new elements we added in Get With the Guidelines Stroke for COVID specifically, separate from the COVID registry, which was also launched this year, showing that patients with COVID who came in with a stroke had more severe strokes, more large vessel occlusions, longer times, but not statistically significant for some elements of care, but certainly for door to CT, door to needle, door to thrombectomy. But good news, rates of thrombolysis and thrombectomy were unchanged between the groups. So we did the job, it just took longer. Unfortunately, that also meant decreased odds of independence at discharge, higher odds of mortality, whether that's the combination of the delay plus the underlying illness or just the illness itself, we don't know, but it certainly adds fuel to the fire that COVID has an association with stroke severity that impacts patient outcomes. And, you know, when you think about reasons why TPA wasn't given, not surprisingly, the need to put on additional protective equipment had a big impact on the patients with COVID-19, while the traditional reasons for difficulty treating or delays in treatment, hypertension requiring aggressive control with IV medication, much more common in the patients without COVID. And Steve, this is a really interesting study of disparities by race and ethnicity in the use of endovascular therapy among patients who arrived with an NIH stroke scale score greater than 6 within 6 hours, so eligible by time and severity, showing that there is still a persistent but narrowing gap between non-Hispanic whites and Black patients. Fortunately, short-term outcomes are as good or better, and modified Rankin at discharge was the same. Unfortunately, 90-day outcomes were worse in Black and Asian patients. We don't know why, but it's an important area of research, particularly as we think about social determinants of health.
Absolutely. Good news and bad news, but plenty of work to be done.
Yeah, and how about this for good news?
I like it. Increasing use of TPA within 4.5 hours, 80% now. That's remarkable. That's really wonderful.
And despite COVID, further increases in the use of TPA within 30 minutes, door-to-needle time within 30 minutes. They said it couldn't be done, and now we're doing it in more than 25% of the patients. It's really remarkable.
Yeah, hopefully that's going to continue to grow. And look at the EVT outcomes, recanalization.
I mean, we're now reaching the rates that cardiology has had the joy of living with for decades. And I think when you have 90% recanalization, now it's not about the device anymore. It's about selecting the right patients and providing the therapy in a timely manner. 24,000 patients got a TICI 2B or 3 score this year. That's really remarkable. And lastly, Steve, we need to do a better job of getting the right patient to the right place in the right amount of time. And nowhere is that more important than the pre-hospital arena. And this year we have a major consensus statement coming out of many of the professional societies in the relevant space here, with suburban, urban, and rural modifications to that prior Mission Lifeline stroke algorithm that came out more than a year ago. And I think this consensus approach to modifications based on availability of different levels of hospital capability is going to make a big difference.
There's no question this is an important statement. It's going to clarify some guidance for many, many, many places. And it's great that we were able to accomplish that.
So, Steve, I can't wait to see you next year in the Big Easy. I
love New Orleans. I couldn't think of a better place to celebrate getting back together again, and looking forward to that. And I want to thank all of you for everything that you do, and looking forward to a better year ahead.
On behalf of all of the patients that we care for, all 800,000 of those patients, I want to say thank you to all of you for the incredible work that you do all year long. And we look forward to seeing you soon.
Be well.
Well, our thanks to Drs. Schwamm and Messe for that phenomenal and exciting update on the Get With the Guidelines effort and the really exciting science that's come out of the International Stroke Conference. Today is one of my very favorite days of the year, where there's an opportunity to really celebrate our collective work together to further the treatment of both ischemic and hemorrhagic stroke. I can tell you, as a cranial and endovascular surgeon here at UC San Diego, it's been a special privilege of mine over the last decade to essentially see and live in what I'm fond of calling the penicillin era in stroke. And the reason I say that is when we were putting together the guidelines back in 2015 around thrombectomy, the numbers needed to treat really rivaled penicillin. And while the collective work of all the teams that you're seeing beautifully highlighted inset on the slide really has made stories like Myra more routine, and hearing her telling, and I think for those who take care of stroke patients every day, it's no less exceptional. And one of the things that I'm so proud of, and thinking about the work of the AHA and that hashtag Relentless Together, and I know that no one on this call is really at all complacent in the gains that we've made in the treatment of stroke. And everyone in a very forward-thinking way is thoughtful about the work that we still have yet to do in terms of patient selection, in closing those gaps that Dr. Schwamm and Messe just outlined, in thinking about leveraging imaging science or even improving our device technology to get even past that 90% that was beautifully brought out in those comments. But the thing that strikes me the most, having had a chance to see the first responders, the nurses, the neurointensivists, the stroke neurologists, the therapists, and ultimately the surgeons working all together, is there's really not an area of medicine that is more of a team sport than stroke. And that's why these sort of events where we all come together and share that collective success, in my view, is so critical and so important. Because once you know the right thing to do in a care of a patient, it is not a small thing to hit that mark every single time for every patient. And I think that's precisely what the systems approach that the AHA has brought is really all about. So I'm very, very excited for what's ahead as we continue to make gains in revascularization, neuroprotection, and neurorestoration. And I know that it's a journey that we're all on together. But knowing that you're working hard, 364 days a year, it's okay to take that one day today along with the AHA to really celebrate what we've achieved. Because when you're part of that larger team, as a hospital care team or as a Western States region, it's hard to actually get your arms around the big picture of what progress looks like. And that's why these celebrations, these shout outs to me are so important. And I can tell you that we are approaching a time through these gains and these incremental advancements where we're making progress against stroke in a way that was heretofore unimaginable. So while we're excited to celebrate with Myra today, and I can tell you we need folks like her in the operating room, there are many more Myras out there that are walking around smiling today because of all of you. So very, very grateful for everything you've done, grateful to be a part of it, and to the AHA for bringing us together. And with that, would love to turn it back over to Rhiannon.
Thank you so much, Dr. Khalessi, and our thanks as well to Dr. Saver, Dr. Majersik, and Myra Wilson for making today's celebration special. I'd like to invite Dr. Saver, Majersik, and Khalessi back for some final remarks before we close out the celebration.
And I'll go first and say thank you for all you do. It is incredible day in, day out, and it was our pleasure to be able to celebrate a little bit today what you do. Next year in person, we'll do it right. Thank you all.
I agree with Jeff. One of the best and most fun parts of my job is meeting everybody who takes care of stroke patients and understanding the multidisciplinary fashion of it. I love going to small hospitals and to medium hospitals and big hospitals and getting to know everybody. And then at the end of the day, it's the patients, right? When you come to clinic and you see how well they've done, or you round in the hospital, that's what makes it all worthwhile. So thank you to all of you for all the work that you do every day. We're just so grateful.
Yeah, and I just lastly say, I don't know a more special group of people in any profession. And this is a labor of love and a commitment. So really excited to celebrate all together next year.
Thank you so much, Dr. Khalessi, Dr. Majersik, and Dr. Saver. On behalf of the American Heart, American Stroke Association, it's my pleasure to thank many healthcare colleagues that joined us today. Thank you for your resounding commitment to the communities you serve and the patients you treat. Congratulations, and we look forward to seeing you in person next year.